Thank you all for coming out tonight for this informational session relative to the APT Foundation and their plans here in Guilford. I don't think I need to remind this community that civility normally rules the day, and I would expect today to be no different. And we would extend the courtesy that we extend to most people to our guests here this evening, and that's what they are. They are guests here in Guilford. So, I want to thank Lynn Madden, the President and CEO of the APT Foundation, for living up to her commitment to inform and educate our community on the APT Foundation itself, the significant need for its services, why they are coming out here on the shoreline, the services they will be offering to their clients, their patients, their hours of operation, the number of anticipated clients on a daily basis, and any security protocols that they will adopt, which they do at all of their facilities. As I have stated several times over the past several months, we had planned to have this session since the first time you guys actually landed here in town. We're doing that to address residents' concerns, inject facts into the discussion, and eliminate supposition and conjecture. The presentation by Lynn will be followed by a Q&A session. The way we'll handle that is folks will line up alongside this wall, and it's first come, first serve to ask questions of the Lynn and some of her team who are here, perhaps, on the APT Foundation itself. That is the subject for discussion this evening. With that, Lynn.
Thanks for being here, everyone. I appreciate the opportunity to try and answer some questions about the services and programs that we are locating in the community of Guilford. First, I just want to spend about 15 minutes. I could talk about this for 15 days because I'm really passionate about this subject and about the work that we do. But I'm going to speak for about 15 minutes to give plenty of time for people to ask questions and to perhaps prompt other kinds of presentations in the future. So we have lots of technology going on here.
Can you speak up, please?
Sure, I can try. There's double microphones. We should be able to figure this out. Right, so APT Foundation is a not-for-profit corporation founded in 1970, one of the first substance use treatment corporations in the United States. Founded in 1970 by Yale University School of Medicine, Department of Psychiatry members, particularly Dr. Herb Kleber, who went on to have a very illustrious and important career in the field of substance use treatment, particularly in the treatment of opioid use disorder. So APT is, as a not-for-profit corporation, is governed by a board of directors, and you can see their names here. They do represent various communities throughout the service area of the APT Foundation. Some of them are relatively new members of our board, and others have been with us for quite a long time. And I can make these slides available as well. The locations of the APT Foundation are here. We have our administration and what we call our central medical unit at 1 Long Wharf in New Haven. We also have the Access Center at 1 Long Wharf in New Haven and our Ambulatory Service Center. And I want to pause just for a second on the Access Center because I myself have heard quite a lot of misinformation already. Access Center is exactly what it sounds like. It is a place where people walk in without appointments, regardless of ability to pay, and they are seen and evaluated by licensed people to see if they're appropriate for treatment for their substance use disorder and or mental illness. If they are appropriate for treatment, they're offered treatment that same day. That all happens in New Haven at the Access Center. That is not going to change. So the program that we are planning for the community of Guilford is not a walk-in evaluation program. These will be persons known to us who have already been diagnosed and who are receiving services already established as patients. We have the Legion Avenue Clinic on Congress Avenue in New Haven. The director of that program is here. This is Dr. Kathy Eggert, sitting right behind Dr. Edens. We have Orchard Hill Treatment Services in North Haven. We have our West Haven Clinic on Front Avenue in West Haven, a fairly large residential treatment program in New Haven of about 142 beds, and a clinic that is planned for 439 Boston Post Road here in Guilford. The reason for the various locations of these programs is that's because that's where people actually live. So 15 years ago, when I first came to APT Foundation, it's actually a little longer now, we have this time clock thing that when you punch in, it tells you how many months or years you've been here. It's 17 years and 10 months, it told me this morning. I'm like, really? You have to tell me that? So every day you have to remind me. But we have been, since that time period, really strategically thinking about where people live and moving services closer to where people live, because that actually advantages those individuals. Right? They don't have such a high treatment burden. They don't have to drive into New Haven every day or every week or every month. Therefore, they have more time to care for their families, to get to tend to their employment or their education. Right? So it's a strategic direction that we're actually taking to think about where do people actually live and where should we be locating services. Right? So it's not random at all. And a few operational highlights of APT Foundation so we're slightly out of, here we go. We provided 282,360 direct service encounters. We see our patients a lot, right? So we have 6,394 people, so if you do the math, we have people are in front of us often, right? They come to see us for various reasons that include therapy, psychiatric services, primary care services, vocational treatment, as well as treatment for their substance use disorder that may include medication if they're good candidates for methadone or buprenorphine in particular, two medicines that are approved by the FDA for the treatment of opioid use disorder. And we did do 2,335 walk-in evaluations last year. And what that shows you is that not every single person enters treatment. They're evaluated, they learn something about themselves, they may choose to go somewhere else for treatment, but we provide that evaluation on their behalf because that in and of itself is also a service for them. So what services are we planning to deliver here in West Haven? We are going to deliver medications for opioid use disorder in West Haven here in Guilford. We are in Guilford. I am quite aware of that. We are planning to deliver treatment for medications for opioid use disorder. We are going to deliver primary care services. That includes things like well care, preventive care, immunizations, that sort of thing, as well as more complex care for people who also have a diagnosed substance use. Vocational services, group therapy, individual therapy, and case management. So all of that is happening in an integrated fashion throughout the treatment day. So if we could just talk just a little bit, just to ground this in some kind of conversation, facts about opioid use disorder, because that's what people seem to be most worried about. So what brings people fears and concerns is really when we start talking about methadone maintenance treatment or the provision of medications for opioid use disorder. In our country, 2.5 million people have opioid use disorder in the United States. 25% of them are on medication for opioid use disorder. Pretty much 100% of them should be, right? So the treatment gap is huge, almost 2 million people. We have the highest rate of death in the world from the use of opioids. Medications for opioid use disorder are the gold standard for opioid use disorder treatment, and in some parts of the United States, they're really hard to get. Right? There's not great access across the country for medicines for opioid use disorder. Here in Connecticut, we have better access, and we're improving that by moving closer to where people actually live and work and raise their families. The medicines that are approved for treatment are methadone, buprenorphine, and naltrexone, so 3 of them. There's no quiz, you don't have to memorize that. Methadone is the word that scares people the most. They do have different rules, if you will, although those rules are starting to come closer together, making it easier for physicians to decide amongst that toolkit which medicine is the best fit for the person that they're actually caring for. They are by far more effective than any other treatment. So I'll give you just one fact that I like to stick in people's heads. I have 5 children and 12 grandchildren. Right, so I have a giant family. That doesn't count all the other people that are in my life that I care about. If there were a person in my life who was addicted to opioids in one way or the other, having problem use with opioids, I would absolutely move heaven and earth to get them a medicine for their opioid use disorder. Because if you want to achieve a 1-year period of non-opioid use, if you're a person who's addicted to opioids, your chances of doing so without a medication are less than 10%. Those are bad odds, right? They're less than 10%. The chances of achieving a 1-year period of non-opioid use, if you get on a medication, go way up. And it depends on which of those medications that are actually you and your physician choose that actually kind of determines what the outlook might be. So between 2000 and 2015, the number of people in our country with opioid use disorder grew from 600,000 to 2.4 million. 109,680 people died of opioid overdose in the U.S. in 2022. That's a new record high. I'm here to tell you, unfortunately, in 2023, that number rose to 112,000. So if you take the 110,000 and you divide by 365, that comes out to 289 people a day in the United States, every day, dying of an opioid use disorder, dying of opioid overdose. That's like a giant plane falling out of the sky every day. And for me, in the work that I do, that is really a tragedy. You know, that's the big question. What can we do about this? I think as communities and people, well, how do we deal with that, right? That's a big, giant public health issue. The U.S. costs associated with opioid use disorder and its treatment are significant. It's $53 billion annually in the United States, right? So one last fact here about opioid use disorder and the treatment with medications. When you go to APT Foundation, the mortality rate among our patients, so these are all people who are already known to have a diagnosis of opioid use disorder. The mortality rate is 0.94% per 100,000 people last year. Right? The U.S. average mortality rate in the general population of adults is 0.83%, so it's pretty darn close. And we have years when we actually beat the mortality rate, right? Among a population of people who are already diagnosed with this chronic, deadly set of issues. The comparison data for persons who have untreated opioid use disorder, 14.7% per 100,000. Again, I mean, it's just straight up science, right? I mean, the reality is that that's horrible, that we have 15% of untreated opioid use disorder, persons with untreated opioid use disorder who die on an annual basis, when in fact they can be treated with relatively inexpensive medications and they can live, you know, to recover, right? That's the most important thing. When I teach about opioid use disorder medications, I say, you know, the first rule is basically don't die. Right? If you can just get the person stabilized enough, a lot of people, most of them actually get better, right? Over time, they may not need the medication any longer, but we have to stabilize them and their lives and provide them with treatment services so they can go on and continue to be productive members of our communities. So here in Connecticut, 1,400 people died last year of opioid use disorder. That number is down just slightly from the year before. That's a win. We're glad about that. In the United States, you can see that this is what the trajectory looks like. So overdose mortality rate is just climbing very rapidly. Again, that's more the highest in the world. So why Guilford? Well, here's the data that we actually looked at. As I told you, our first and foremost set of ideas is to use our own patient information to think about strategically placing the programs that are important for people in order to gain their lives back and to have a high quality of life and to live and become and continue to be productive members of our communities. So when we looked at our own data after we moved patients to North Haven, then subsequently to West Haven, right? So we've been doing this over a number of years. This is a 10-year plan. We started in North Haven about 10 years ago, moved people into West Haven about 7 years ago, and now we're here in Guilford. We have about 400 people who are in these zip codes. That is the information that they give us when they walk through the door in our access center. So 55 of them live in Guilford, 97 in Brantford, another 33 in North Brantford, and 22 in Madison. So if we were to go further up the shoreline or to move around a little bit, those data might change, but these are the predominant number of people. So the idea of locating here in Guilford is not random, as I said, right? It's very planful based on the information that we have and the persons who are already using the services at APT Foundation. We're simply moving a small clinic closer to where they actually live. In terms of hours of operation, the program's open at 5 a.m. Our patients can come in, they receive their medication and other services that they may need that day. That could include counseling services, a primary care visit with a psychiatrist or advanced practice registered nurse. It might include group therapy, or it might include individual therapy, but by and large, people come in and out to receive their services. When we look at the people who were on our previous slide that I showed you and their current pattern of treatment, we would have between 70 and 80 people a day who would use that clinic over that 8-hour day. Right, so when you look at the people who are already in care, those persons I was counting when I showed you the previous slide, you're looking at about 70 to 80 visits into the clinic over an 8-hour day that starts at 5 o'clock in the morning. Right, so by 1 p.m., for the most part, we have almost no one coming in and out of the program. We might run an afternoon group once in a while, that kind of thing, but we don't have on a regular basis, we don't have very much traffic beyond 1 p.m. in the afternoon. So with that, I think I'll stop. I mean, I can give you certainly chapter and verse about all kinds of things that I'd love to tell you about the effectiveness of the medication and all of that kind of stuff. But really, that's the reason for moving here to Guilford. These are services that are badly needed in our state, in this community. There are 400 people who live in right here immediately who already are our friends and neighbors here, who are already receiving services. They would receive them more readily here in Guilford. They will receive excellent and holistic care for their treatment. And the treatment primarily, as I showed you, prevents people from dying and allows them to live their lives at full capacity.
Lynn, could you talk a little bit about your security protocols before we move on?
I can. So that question has come up quite a bit about security. I can tell you that I personally have worked in clinics like this and inpatient psychiatric locked institutions since 1990. I don't have a lot, if any, stories I could tell you about any security concerns that I have ever experienced. So you should know that there are people who we call security that are at all of our locations every day, right? So there will be minimum of 2 people. They come in around 4:30 in the morning and they stay there until the clinic is closed. In most of our programs, what they do is sort of like traffic management in the parking lot. But from time to time, like in any place, you may want to ask somebody that to move along or to discontinue a particular conversation or that kind of thing. We have security personnel on site. In terms of the medication itself, there are very stringent rules from the DEA. the Drug Enforcement Agency. They have approved the design of the clinic that we are planning to build here, and they have, because they have to. We have to get their permission before we can do anything. So the whole building is actually swipe card protected, and it's what we would call a double protection system, right? You have to swipe card in, but you may also need to use a pin pad depending on where you're going in the facility. And the pharmacy area itself, which is behind another swipe card access, so that if you're going into the pharmacy, let's say as a nurse who's going to be dispensing medication, you would swipe in or pin pad yourself into that pharmacy as well. We have not had security concerns in our other clinic related to the medication or to the traffic management around the building. The exception to that, as I'm sure all of you have read about from time to time, is the Congress Avenue program in New Haven, where we have a clinic in a very busy and congested area, and that sometimes has posed some real difficulties. We have worked with that are not entirely about the APT Foundation. We have worked extensively with the city and with the Hill North Management Group there in New Haven, and we will continue to do that.
Lynn, thank you for that presentation. You line up on the side. Is this one working?
Okay, so I'm going to use that.
Okay. First off, thank you for coming tonight to answer our questions. I do have a question concerning what happens. Okay, I'm sorry.
The other mic. Skinny mic.
Oh, this one, sorry. I do have some concerns with what happens outside the facility when these facilities open. What can you do to assure us that what happens at your other facilities won't happen here in Guilford, such as outside, drug dealers outside, needles found in neighboring yards and parking lots, people defecating on your property, number one, and number two, fights, people sleeping out on your property. There was even a case of someone said that people were sleeping outside and openly smoking crack on the outside the New Haven property. I want to know what you can do to assure us that this is not going to happen here. And then also, the other half of my question is if you can assure us it's not going to happen here, why aren't you doing it for your other facilities?
Yeah, I mean, I don't know exactly how you want to do the format. The situation that you described, some of that does happen around our Congress Avenue program in New Haven. Again, it happens around the Congress Avenue program in New Haven, not entirely at that program, number one. The other locations that we have, we do not have those concerns or considerations. That is not happening.
It does happen because
North
I've...
Haven and West Haven.
What? This is not an argument.
Okay,
She's answering
okay.
your question.
Okay,
In North Haven and in West Haven, we have not had those concerns or considerations. We have people who come in the morning, they receive their medication or their other services, and they leave. I have not had reports of that from West Haven or North Haven.
Can I comment on that, or am I allowed to?
Pardon me?
Am I allowed to comment on that?
No, this is not comment, this is question and answer.
Oh, no, okay.
That's how this was built. No. No, she cannot. We defined the methodology today. If you don't like it, you leave. Catherine, thank you for your question. Do you have another question? Do you have another question?
I do have one question then related to that. In North Haven, I was told by a North Haven police officer that this does happen. Are you here today to say that that doesn't happen, that needles aren't found in parking lots, and that people do not sleep out ever in front of your North Haven facility, and that drug dealers are not nearby?
Okay, so what I'm going to say is those reports have not come to me. I will offer.
Please.
Those reports have not come to me through the police department or through any other kind of mechanism. Those reports have not come to me from North Haven. The other thing I would say is that, you know, we live in a universe where there is a lot of drug use going on. I tried to show you some of that data. There are needles in parking lots everywhere in these communities. Okay,
Please.
I will believe you. if you
This
say
is
that.
not. One at a time. It's one
But
at a time.
that's what I can tell you, is that there have had no concerns or complaints raised to me from the North Haven Police Department, nor to our clinic director, Dr. Kim DiMiola there, who's in regular contact with the North Haven administration.
Thank you.
Yeah, welcome.
So I actually have a bunch of questions, so hopefully I'll be allowed to do that. So the first set of questions are for Lynn. My name is Lori. My first questions are for Lynn. So you briefly touched on the 0.94% out of 100,000 that get a year of methadone and no heroin. That's what you said?
No, I was really talking about the rate of death
Oh,
among the
okay.
patient population.
What is the cure rate?
Yeah, okay, so that's a good question. And opioid use disorder is a chronic illness, like every substance use disorder, right? So a person who's diagnosed with a chronic illness has that illness over their lifetime, and they may have it more acutely at one given time than another. So people sometimes are more ill at one point than they are at another point. When we're talking about methadone in particular, right? So what we would call the floor, when you look at the research, is that the recommendation is that a person stays on methadone for at least 3 years, right? And so they stay on methadone for at least 3 years, and that is the kind of, as I said, the floor that could predict a period of recovery if a person is appropriately discontinued from that medicine. But like every chronic illness, there are people who would stay on it forever, right? There are some people who need to stay on the medication over their lifetimes. Think of it like more like diabetes. If you have diabetes, type 2 diabetes, you might be able to do exercise and change your diet, and then you could go off your medications. But there are people who have to stay on these medicines forever. So it varies person to person, but the real recommended floor from a clinical perspective is 3 years.
So I'm going to jump to a next question that I was going to ask third, but so when people go on maintenance, they're actually given the drug and they can leave with it, correct?
Yes, eventually.
So I'm going to tell you a story about my personal experience with my brother.
no,
But I
no,
need to put this in context, Matt. I am a citizen of this town and I should be allowed to talk.
This is not the time.
My brother was on methadone. So I can talk about this from a first-hand experience, and you shutting me down is not right.
Where's your question? Get to your question.
So my question is it not true that when people are given their methadone and they're not really there yet to be better, or whatever you want to call it, they go out with that methadone and they sell it? Is that not true?
I think sometimes that is true.
Yeah.
Yes. But
So-
I will tell you that people, if you could let me answer the question,
Sure.
that would be really helpful. I will tell you that people are allowed to take home medications, just like they do with other medications. And there is a checklist that
What other
physicians-
medications? What are you talking about? What are you
any
equating it to?
prescription medicine that you might receive.
Yeah, you can't
right?
equate
so
this
that
to
you take that home. You take it home and you manage the use of your medicines. In the world of methadone treatment, there is quite a stringent regulatory structure, and there's a checklist that the Substance Abuse and Mental Health Services Administration of the United States puts out. It's an 8-point checklist that our clinical team members are using to try to be sure that people are able to manage their medication.
Okay, my next question is, so when somebody takes their medication, what happens? Do they have like a a moment in time where they need to take a break before they do anything, or can they hop right into a car and drive off to work?
So medications, we have people here who could probably answer this question more clinically, but essentially when you're prescribed the medication, we start out with a lower dose, right? And over time that dose goes up, and every day when they receive their medication, they're actually in observation of a nurse when they receive their medication, who is observing them for any kind of side effects that may be occurring or any reason not to have that person take their medicine that day. So what's called induction, we ramp that person up slowly over time until they get to a dose that works for them.
So when they take it, they're not fully functional.
That's not entirely accurate, right? I don't want to get into really like a heavy clinical conversation, although I'm happy to do that at some point.
Well, I mean, I've witnessed it.
When they take their medicine, if they're having symptoms that are that mean like they're drowsy or that kind of thing, then we would think about adjusting their dose or trying to figure out what's actually going on for them.
Okay, next question for you is, what do you plan to do with the 2 adjacent lots that you purchased?
Yeah, we purchased the property, it's all contiguous. There's one lot in the middle that can't really be used the way it is now, the way I understand it. It has wetlands considerations, right? We purchased it because it was actually a single sale with the property that has a garage on it, right? And we'll be using that garage to actually put some of our equipment in. So that's what we plan to do with the property. We'll make a single sidewalk, because the city planners asked us to do that, and we are using the garage on the other piece of property.
Somebody brought this to my attention. So are police allowed to go on your property?
It is private property. We do have good relationships with police officers in all our communities who come and go off our properties.
So they're allowed to go in and monitor things?
No, they're not there for the purpose of monitoring. We have security team any more than they would go to McDonald's parking lot and monitor, right? I mean, we have good relationship with police in the communities we work in. If they need to be there, they would talk with one of us and we would work through that.
The other question I had for you, Lynn, is how many hours each week or how many days each week do you spend at the clinics?
It depends.
Just give me an average.
I'm mostly at One Long Wharf in administration.
So you don't go to the clinics to see really what's going on?
I do go to the clinics, and I have staff who are here tonight who work in these clinics.
Before, when Catherine brought up about the needles and such, you said you didn't know anything about them.
I said I don't know anything about that, and I have not received any complaints from my staff, my security
because
staff.
they're inside those locked doors.
No, because I haven't received any complaints from my security staff, the maintenance staff, the people who pick up around all of our buildings, the police or administration in either West Haven or North Haven.
Matt, you're next. Have you spent time at any of the existing clinics? And if so, how much time?
I'm not here to answer questions. This is
What?
about the app.
Aren't you the first selectman?
Would you, listen, what was this billed at? This was billed at a question and answer session
You're the one that
for
approved
the
it.
app foundation. I did not approve
I
anything.
was on the call. I
did
watched
not-
you yell at Kevin.
What's your question? What's
I
your
just
question
asked
of
you,
Lynn?
have you
What is your question of
visited
Lynn?
any of the app
What
clinics?
I personally have seen the North Haven facility.
And have
I've
you
never
spent
been in
any
it,
time?
never
So you
been
just
in
drove
it.
by? Okay, just need
That's
to
it.
know that.
That's it for questions here.
What about our, the impact studies of our town? Have we done anything like what it's gonna do for our public services? Or is it going to raise our taxes because we need more police and fire?
This is not the time for this conversation.
When is it? Listen, on that you said you would not do one of these meetings. You said that. I heard you.
I said
And
what?
You said that these meetings are not necessary because you didn't
I
want to
never
answer
said
our
these
questions.
meetings were not
You
necessary.
absolutely did.
I did not.
You did too. It's on tape.
Public hearings are unnecessary. This
This
is
is a public hearing.
No, it is
No, it's
not.
not.
It absolutely
Not by
is.
the definition of our charter.
So you work for us, but you won't answer any questions.
I'm gonna read the statement that I was gonna do at the end of this.
This is really sad. It's really sad that you're
If
forcing
you'd
this
like to
into
speak, you
our
can come up here,
town,
but it's
but
not
you won't
helpful
answer
to
any of
chirp
our
in like you're in the
questions.
cheap
I
seats.
will answer your questions,
And
and not in
I'd
this
love to hear what
forum.
you have to say.
Oh, where?
constructively.
People
Wait a
are
second.
sending you emails and you don't answer
Would
them.
you please refrain so I can read the statement? I just want to set the
Is it more
record clear. I
gaslighting?
want to set the record clear on a couple of things. First off, the Board of Selectmen, the town planner, and planning and zoning acted in compliance with all statutory charter and zoning code
After they were
regulations.
changed.
In fact, if the foundation had not proposed any changes to the building which triggered a site plan, the change of use permit would have been issued on an administrative basis by the town planner because it's an as-of-right use of this property, which goes to basic property rights as enshrined in our zoning code and in state statutes. As it relates to public hearing, they are not required, they are not stipulated for a simple site plan application or a straight use of business change. The Planning and Zoning Commission could not have considered any input on the type of business being proposed, just on the site plan changes itself. And if anyone would like to directly talk to me, or I'm sure some of my fellow board members, that please reach out to us, and I will be happy to have a conversation. There's at least a couple people in this room who I've already extended that invitation to and have accepted it. That is the forum.
So why
at
do
this
we have
point.
to do it in the cloak of darkness? We
It's
can't do
not
it out
cloak of
in the
darkness.
public
And I'm
so
not here to
everyone can hear
argue.
everything.
Your time is done. Next up.
Good evening. Can you hear me? I'm Rosemary Bagish. In 1970, I actually worked with Herb
You can
Kleber.
keep talking. Otherwise, you wait until you get up at the mic like everybody else. I understand. You're the one who's disrupting things. You haven't stopped talking since you sat down. If you want to come to the mic, you come to the mic. In the meantime, wait for it. You got that discipline?
Please, go ahead, start
I'll
over.
start again. I'm Rosemary Bagish. In the 1970s, I actually worked with Herb Kleber when the APT Foundation was founded, and I'm very aware of the good work that you have done for all of us.
Can we get to your question, please?
My question is, will you be treating adolescents and will you be offering family support to our neighbors in Guilford and the surrounding towns?
Thank you, Rosemary. Thank you, Rosemary, for the question and for your work, real pioneer. I have met Rosemary before now, so I will say that we do not at the moment treat adolescents. We treat a lot of young adults. One of the things in our strategic plan is to really think about the treatment of adolescents. If we had a different kind of time together, I have some really interesting state of Connecticut data that shows that about 2% of our high school seniors in the state of Connecticut have tried heroin. 2%. 23% of people who try heroin and go on to use it more than a couple of times, about 23% of people develop an addictive disorder. So 2% of our high school seniors have tried heroin. Right? That's very concerning kind of thing, and we are thinking strategically about how to address that. In terms of family support, we do family therapy in our clinics, and some of our clinicians are actually licensed family therapists.
Thank you.
Thank you.
Hi, everybody. I'm Lee Altieri, local resident here. Lynn, thank you, and thank you to the board for coming today, and thank you for the job that you do. Addiction services is not, as we can see, not the funnest to get into. I think I have 3 questions. I'll try to make them go quick. I manage the FedEx facility directly across the street from the North Haven APT Foundation. It seemed, though, that the like once a week the traffic was heavy. Was there any particular reason why that was? I know there's more than one business there. It just seemed to be a lot of people like 1 day a week? Was it maybe one therapy session or something that was going on?
I don't know the answer to that. When I look at the number of people who come in every day, it's pretty even.
Okay.
Right, there's also a pizza place in that same
Right,
building. I don't know if
exactly.
they have like a special on 1 day a week or not. But we went to that pizza place across the street from me, yeah.
Okay. The other question, the one drug that you didn't mention was Suboxone, which has obviously been very successful with addicts. Is that something that you also?
So I mentioned buprenorphine. Suboxone
Right,
is
so
a
it would
trade
fall in
name
that with
for
naloxone, okay.
buprenorphine, that's right. And in this particular program, at the moment here in Guilford, we are not planning to offer Suboxone. We do have many patients who receive Suboxone in our New Haven facility at Long Wharf. So we have not distributed that treatment to the other treatment programs in North Haven or West Haven either.
Okay. And my last two, again, I'll go quickly. Most of the drugs that you did mention, a psychiatrist could prescribe to a patient and they could get at CVS or Walgreens, correct?
That's right.
Okay. And then lastly, just with for my own personal sake, the therapy that you were speaking of and taking care of, are you asking patients to seek outside therapy? Do you ever encourage anything like attending NA or AA meetings as a follow-up?
Also a really good question, thank you. So in our facilities, people are required to receive therapy from us. And they're allowed to receive as much of that therapy as they want, but they have to receive a minimum amount of therapy of at least 1 hour every month, in addition to seeing a nurse when they receive their medication, right? So we have people who come to 10 hours of group therapy during the week because that's what they feel like they need. So when I showed you those numbers of
Right.
6,000 something patients and 280,000 sessions, that's because people come multiple times.
Okay.
Yes, we definitely encourage people to use other community-based groups such as AA and NA, and many of our patients do that.
Okay.
Yes.
And just so to know, I've never found any needles on the facility at the FedEx station.
Thank you.
Thank you. So my name's Renee. Thank you. I'm just nervous.
You gotta hold the mic up.
My name's Renee. Thank you. I'm just nervous, so I'm just gonna look at you, and that's okay, and talk. Thank you, Lynn. First off, I want to say that I applaud what you're doing. You know, you do, and I'm not gonna get weird, but like God's work, right? I'm Catholic. I recognize that there's a need to help people, and we owe that as humans to each other. My concern is the location, okay? You're around the corner from a daycare. You're across the street from a Dairy Queen that our children go to all the time. It is a local community place where kids go and they hang out. You are very, very close to the street at this location where there's no anonymity for your patients. And I think it's very interesting too that you're spending like $2 million+ when you're a nonprofit for 400 patients. So that's interesting to me. I don't know how often they come. So if the target audience is 400 patients and you expect, 70 to 80 a day, I don't know how often they come. But how do you restrict walk-ins to the Guilford location for people who are not registered into your program? How do you restrict that? I think that's like one question I want to start with, because like I said, it's not the treatment and people need it. I get that. It's the location and our environment here.
So thank you for that really thoughtful question. I will say a couple of things. In terms of people just walking into the program, this is not a public facility, right? So people will come to the program because they're registered at the program. So we don't have that issue in our other clinics where people kind of randomly show up. at the program, and I'm not worried that that's going to happen. I want to just remind everybody about the hours of operation. So where it's 5 a.m. to 1 o'clock in the afternoon, 6 days a week. We're not open on Sundays, right? So there's not evening traffic there or late afternoon people hanging around. And my experience is, in our programs, particularly in West Haven and North Haven, people come in, they do what they need to do, and they leave because they have other things to do. Just like if you and I went to a medical appointment, we don't stay there. There is not going to be a big concentration of people because there are not a lot of people who are going to be registered in this program, right? So that's the other reason. When you think about kind of the healthcare economics of this, it works. I can tell you that it works. But part of the distributed nature of treatment is to decrease, if you will, the number of people who are there at any given time so that we can increase efficiencies on their behalf and our own, right? They won't be waiting around because there won't be a lot of other people there for them to be waiting around for, right? It'll be very easy for them to come in and out and receive their treatment. We do monitor our parking lots, and we will, again, as I said, I appreciate the thoughtful question. Do you have another question?
I do. I just have a follow-up to that. The readings of the articles that I've found online, reference that Congress is the most challenging for you from a security perspective. That is in a residential area. This area in Guilford is a residential area. Homes are within walking distance.
It's a commercial zone.
But, okay, regardless, there are homes in the vicinity, as well as, like I said before, a daycare center. But to that point, I understand that the other areas have less loitering, less activities that require a police presence. I understand that you do pay for a police officer to be present at least one location, but those other locations, such as, I believe, I think it's North Haven, I could look it up, but they're not in areas where there are residences in the vicinity. They're more industrial areas. So to your point of they don't have people to go talk to, and they meet there and then they leave because there's nothing around, they're more vacant areas. Mm-hmm. So, to that point, as well as, honestly, if this is targeting and to support people within our neighborhoods, which again, I appreciate, there are people who are going to see them coming in. Mm-hmm. And how do you feel about their being reluctant to go to such a conspicuous location to receive treatment? Because there are going to be people who recognize them and see them, and does that factor into your concept that they will, or your anticipation that they will actually come to that location?
Mm-hmm. Yeah.
And thank you.
Yeah, you're welcome. You're welcome. That's a lot of questions.
Sorry.
And I could go into some conversations about stigma. I think what's one of the things that we've noted is that if you were to go to our West Haven location or our location in North Haven, there are homes within walking distance of both of those locations, literally. They are, however, in commercially zoned areas. The same is true here in this community. So part of the reason people ask me, how did you select this piece of property? It's the right size, it's the right price, it's properly zoned for our use. It has been even before the zoning regulations shifted. And this is why we were interested in the property. We are not intending or believing that we will disrupt the neighborhood. I think this will be very, very quiet. I don't think that you will notice that these things are going on. People who had concerns in North Haven, we were having these conversations almost exactly 10 years ago in North Haven, a very similar conversation. The things that people were worried about have not come to pass. In West Haven, that was also true. So what's that?
Did New Hallville open?
No, we don't have that property in New Hallville.
So what prompted your decision to not open a location at New Hallville?
Yeah, there's a lot of things about that property that prompted that decision, but we actually sold that to another nonprofit who will be opening something else in that neighborhood.
So you do have an out if you choose not to open here. You could sell this property again.
I suppose that's possible, but from our perspective, this is an ideal location for us, given the size of the program that we are planning for this community.
But somehow you chose to buy a $2+ million property in New Hallville, and then after a lot of community pushback, you abandoned that location.
Yeah, we did shift our thinking a bit about building a large building, such as using another large building like that in New Hallville, and really moving into these smaller kind of more community-based pieces of property. Yes.
Next up.
Yeah, hi, I'm Mike Macris, and my question really, and the reason I'm here really is because of process and trying to understand process. The reason I'm here is because of process and my trying to get a handle more on the process. The reference just made to the New Hallville activity. I did follow that in the New Haven Register, and I noted that there were public hearings, a lot of pushback about, I guess it's in Dixwell Avenue, and after, the New Haven Register said after months of negotiations, a deal was made with the Elliker administration to have it go to Long Wharf. Is that not right?
Not exactly, no. It's not. We are already on Long Wharf.
Right, but
we have property on Long Wharf.
yeah, no, your headquarters are there, but you were going to put.
We have headquarters there. We also have our access center. We have a methadone maintenance program there. We have a primary care program there. So the services on Long Wharf are staying on Long Wharf.
So
they're just moving into a different building that the city will. It's part of a development that the city is doing for that whole part of the community.
So the what was being done was planned for Dixwell Avenue.
Okay, so
where is that going to be done?
Yep. What was our initial thought of thinking for Dixwell Avenue was to move out of rented space that we have on 1 Long Wharf in New Haven. That's the only rented space that we have now, right? And this is before the larger development of that Long Wharf district in New Haven was on the table. Instead of moving our services out of rented space on 1 Long Wharf, so there's no new services being proposed, right? It's the same services. We're going to move slightly across the parking lot, basically, into a building that we own instead of a building that we rent. Right? But those services are the same. Those are not newly proposed services.
Okay, well, let me get to my process question. I mean, I was mentioning these things because a process did go on in New Haven that caused a change to be made as to the Dixwell, the New Hall property. So what I'm trying to get my head around is, I mean, you knew this was going to be a controversial project, I think, because, well, it was controversial in North Haven, you said. Why did you decide to wait to have a forum like this and to discuss some of these questions and to discuss location until after you were in a position to say it's a done deal and nothing could be done? That's the question I have.
Okay, so that's it. So respectfully, what I would say is we did not expect this to be a particularly controversial process. We are moving into a building that's in a commercially zoned area, right? What we're planning to do in that building is permitted by right. That was a respectful decision that we made based on the zoning laws of this community. And we followed all of the process steps including meeting with folks at the city administration. All along the way, we've worked with planning and zoning, we've worked with the wetlands people. There has been absolutely nothing secret about this process whatsoever.
When did it first get announced to the public? When did it first get announced to the public?
We first spoke with city administration in about a year ago now.
Yeah, but, well,
Thinking about,
so a year ago you told the current administration, I mean, I read the paper every day. I didn't hear about this till when? I mean, a month ago?
Right. I observed the request for confidentiality when the App Foundation came here, like I do with any other business owner that comes to Guilford looking to purchase property. For instance, I had conversations with Target long before that became public domain information. It was out of respect, and it also could have impacted their ability and the price on that piece of property.
I mean, I think part of the reaction at some of the crowd here is the feeling that we as a public were not respected. Maybe there could have been input. Maybe there could have been input in the process about whether there is a better location in Guilford, which was not made available to us.
Thank you for the comment. Next question.
Hi, my name's Lee Smith. Thank you for the work you're doing. Thank you for saving the lives you'll save. One of them's my son. I did not come here to make that statement. I did not know this would be this kind of forum where people would be so objective. How do you guys do the work you're doing during the day and do this at night? How do you, thank you, Matt, for doing the right thing here. This is not a question. Thank you for doing what you think is the right thing to try to help people. How many Guilford kids of the 55 would you save? One of those 400 was not my child. He was a few years before. One kid for $2 million for their money, for nonprofit, for 400 kids. That's worth it if one of them's your kid. My son was one of them. These people are not all bad. They're all sick. They're trying to get help to the best of their ability. They're not there to get high. Okay.
So the question that I heard actually is how do we do the work that we do? I actually think that that's a really fair question, right? Some of my staff are here. They got up at 5 o'clock this morning or 4:30 and went to work. We're here now. This is what we do. We're committed to delivering quality care. We want to hear what you have to say. I can tell you that in my 35 plus years of doing this, I have heard a lot of questions and concerns from people all over the world, all over the United States. I literally work in other countries to bring this care to them because people do die, right? I am committed to making sure that this is integrated safely and appropriately in your community. My staff is committed to that, and that is what that is working in several communities around you. And I actually look forward to continuing a conversation with community members.
Debbie DeMusis. My concern is that I read an article recently, and it did talk about the APT Foundation, and it does not work well in residential areas. It works better when it's outside of a residential area. And although people are saying it really isn't a residential area, one of our first selectmen literally lives around the block. So it is in a residential area more than it is in a industrial area. I think many of our concerns are that it's not just that people's appreciation of their homes might drop by a lot, although we constantly are being increased in our taxes. I do have empathy for the people that have to go there. I understand that, but I also don't understand the fact that you say that if people are on methadone for 3 years and they're on this level, well, what happens to them after that 3 years? I would like to see an agency that does preventive measures. We have people in Guilford, and we do have a lot of our young students involved in a lot of unsafe activities. I would rather have a large amount of money and a nonprofit who has been in business since 1970 show me some real facts of how they have actually really helped people to move on and prevented people from getting addicted than have a methadone clinic in town serving. And again, you say there's 400 people. There may be 400 people, but on your list, it only adds up to 207 people. So maybe there's some other people that I don't know of.
Right.
But those were my concerns, is that you chose another residential area. And I also feel that, unfortunately, okay. So why did you come to Guilford? Were you welcomed with open arms in Guilford? And was there a previous contract on that property?
I don't know if there was a previous contract on the property, not that we had, that APT Foundation.
No, that it was under a contract when you went and noticed the property.
I have no idea.
Okay.
I don't know that. When we made an offer, we bought the property sequentially, right? One at a time. The one with the garage on it is the property that we bought first, and then the...
But it was all one piece.
No, those are two sales.
Okay.
Those are two different sales. So there's the property with the garage on it and the little building, and then the empty property, that was one piece. And then the property 439 Boston Post Road. But to your question, as I understood it, or your comment, I think we would all like to have prevention services. We do have some good prevention services in our communities and in our state, but honestly, we still have a really big problem with people who end up addicted to opioids. We have not been able to entirely prevent that or prevent addiction to other substances such as alcohol or cocaine or methamphetamine. I mean, all of that is with us.
Right, so why spend all this money on the end when you should be spending it at the beginning, preventing it? Spend the money to prevent our young people from becoming addicted.
Yeah, the state of Connecticut is... I will tell you that the state of Connecticut does spend money on prevention services, but I don't look at treatment as the end, right? For many people, treatment for their substance use disorder is what saves their life, and then they eventually can go on from there, because not everybody who receives prevention services refrains from using drugs and alcohol. I mean, that's just not the reality of the situation, right? Other questions?
Yeah, Lou? Sure. Mike.
Okay, makes sense.
Okay. The location question is intriguing to me. And it's also tied into the, use of a piece of private property. People take the concept of private property very seriously when it's their property. And the idea that there's a groundswell for additional steps for someone to use a piece of property that is consistent with longstanding regulations feels irresistible until it's your piece of property. It's somewhat antithetical, in my estimation, to ask for government overreach because a particular use doesn't feel particularly satisfying. My point exactly. And so I understand how someone is opposed to that, but this particular property is zoned the way it's zoned. This use fits in that use, and these people bought the property. And the request, as I'm understanding it, is to add additional layers of regulation and approval that are beyond what's in the zoning regs. That's sort of the piece of private property and the government reaction to that. With regard to the other APT Foundation locations, I'm intrigued with this concept of a quarter mile from homes. If you take a look at the Long Wharf property, it is quite literally less than a quarter of a mile. It abuts Halleck Avenue and is a quarter mile from Howard Avenue. These are very densely crowded neighborhoods. They're directly behind this facility. Someone could walk out of there and walk up into those streets. That is just a stone reality. The useful process, in my opinion, of an adversarial in the best use of that word, meaning some people have an opinion and they provide that opinion and the effort gets taken to figure out whether it's sustainable or not, led me to take a look at this location, and I was struck by how close that was. Even more striking, and this is a little anecdotal, but even more striking is the North Haven location. I have been to that North Haven location, the restaurant right next to it, 150 times. Okay, I work 2 miles up the road from there. There's an apartment building less than a quarter of a mile away from that location. Across the street, as we heard, is a very industrial area. There's FedEx, there's a container factory, they make cardboard, whatever they make, it's very industrial. The north side, west of State Street, is restaurants and the Whitewood Pond Apartments, which are as close as any of the concerns that have been expressed here. I'm just saying, some of the ideas that this is landing in an area that's completely contrary to what APT Foundation already has, I don't think are borne out by at least Google Maps and the facts. Yes, it is Guilford. And the idea that Guilford doesn't have the similar problems is an assumption that you are certainly fair to make on your own, but that's not necessarily going to carry the day with everybody.
Next up, John.
Charlie Melvin. I'm a Guilford resident. I'm a Guilford resident. Can you all hear me? Okay, great. I'm also a nurse practitioner in psychiatry. And so I guess from that platform, I should say something to everyone, because we just talked about how to do prevention. And everyone can participate in prevention. If you're someone who takes a medication, who takes more than one, who perhaps has an expired medication, please look at it. Police officer over here, thank you, has confirmed that the Guilford Police Department is open 24/7 for return of medication. Yes, okay, but, yes, okay, but that's an important public service, okay? So what I wanted to say, and I reflect on, frankly, my 18 years of working with patients, but the last thing you need to hear is an expert opinion. So I called my patient. So I would like you to endorse this, okay? He cannot be here because he has a great deal of shame. He's a Guilford resident. He's one of the 55. So he deserves a voice. So I'm here for him because he's any one of you. Okay. Okay. He would like to know. Okay.
You could ask on his behalf.
So I would like to ask on my patient's behalf how he can be treated like a human being with respect, because he is staying at home, he's depressed, he's anxious, he has started at 70 milligrams of methadone. He has gone through the streets like a warrior. I met with him 32 times since 2012. And I've learned that he has gone down to 30, he's gone down to 20. So how can he be treated? My question on his behalf, okay, is how can you assure my patient and this community that the treatment will be humane and respectful?
Thank you.
Thank you. So I'm not entirely sure I understand your question, Charlie, but if you have a clinical question, I would be happy to give you my card, and you can pass that information on to this individual, and we can answer that on his behalf. What you're describing, the taper from the medication, is usually done in conjunction with the person. right? So I don't know the situation, if that's what he's asking for, or what other clinical issues are going on there, but we can put him in touch directly with one of our physicians or advanced practice registered nurses. We're happy to do that.
Okay.
Thank you.
Thank you.
Hello, thank you. My name is Diana. I'm also a psychiatrist. I do work in an inpatient forensic setting, and we've referred plenty of clients to APT, so thank you very much for the work that you do. I think this whole setting is, it's a lot. I appreciate your calm during this meeting. The location concerns about everyone's been saying that, different location, the daycares, the crime risks, neighborhood, all that. And, I'm not an expert in methadone maintenance, I'm not an expert in opioids, but I don't think there's an association between, child kidnapping and methadone, right? As far as I know, I did a little bit of research, but this is definitely not my specialty. So, or pedophilia, or I'm not sure. But I wonder if during a future meeting during some other forum, there could be some data on the incidence of crime compared to, I know there's some state data about liquor stores or hospitals or the convenience stores, and the difference in crime compared to those locations, and it doesn't seem to be much different, I think, compared to a convenience store or something. Mm-hmm. But if we can have some of that real data, and then also because Guilford is a little bit different than the bigger communities of West Haven, North Haven, New Haven, and because we are kind of a closer tight-knit community, I wonder if what kind of research we can do once the clinic opens, because there'd be a great opportunity for teaching, a great opportunity for community involvement, and then a great opportunity for research in a very kind of suburban neighborhood compared to West Haven, compared to some of the other spaces. And I think it'd be a really nice opportunity to kind of, if it works, we can show it and, kind of change some of the stigma. That's all.
Thank you. Try and answer that question directly. No, I didn't get into a lot of data because I wanted to leave a lot of time for questions. There are some of those data that are out there. I have actually worked on some of those studies. Had a colleague, Dr. Jane Maxwell, who recently left this earth, but she did a lot of the pioneering studies around what happens in communities to crime rates when methadone treatment programs or other substance use treatment programs come into communities. And generally speaking, the crime rate declines. And so one of the things that we could do, and it's particularly crime that's like people stealing money out of your car kind of stuff, right? That kind of thing that people do to buy drugs. One of the things that we could do potentially here in Guilford is to take a look at that. Just kind of, the crime data is pretty public. We could take a look at that over time, and there may be other things that we could all look at together as well. Yeah, thank you for that. Yeah.
No. If you're going to ask questions, you come up.
Yeah, the reason that the crime decline has declined. The reason that crime declines is because once people enter treatment, they stop committing those kinds of crimes.
Okay, next up.
Hi, my name's Mary Colella. I wasn't planning on talking or asking questions. I'm an antique nurse that used to work in the hood of New Haven at the Methadone Clinic. Okay. So my question is, will you be doing maternal child? Will you have children? I used to go into the Methadone Clinic in New Haven and have to take care of the heroin-addicted babies and their mothers. Will you be doing that at this clinic?
So we do have some people who are parents who come into the program with their children, but not very often. We have a different program for mothers and children that's a residential treatment program now, that's in a different location, so that didn't exist at that time.
No, it didn't back in the 90s.
Right, exactly. So that there are some specialty services for mothers in particular with small children. However, in our clinics, the one on Congress Avenue, we do have a person called a child watch specialist. So if you have a child with you The child watch person watches your child
Oh, good.
while you receive services there in the program. But that's not in every one of our locations, and that is not planned for this
It's not planned
location
for here?
at-
Okay.
At this time, right?
Okay, and my other question is, do you provide lock boxes for the methadone when your patients
We
get
do.
their meds?
We do,
Because I
absolutely.
used to also go into the homes and administer psych meds to patients in the Hill section.
Yeah, so what she's referring to, is it Mary?
Mary, yes.
Yeah, what Mary's referring to is that when a person is more stable in treatment and is able to take some medicine home with them, we work with them to make sure that that medicine is in a secure container, and we teach them about medication safety.
Okay, and then one more question. Will you be doing any research regarding other medications that are not addictive, like methadone? Because methadone, as you know, is an addictive medication.
Methadone is an opioid, that's
Right.
right, and it has the same kind of profile as other opioids. The saving grace of methadone, honestly, first of all, it's administered legally in this setting, which means persons are no longer committing a crime, but methadone also has a really long half-life, which what that means is it stays in your body for a long time, which means your brain is in a more steady state than if you're using drugs. When you're, high and then you're not high, and then you're high and then you're not high. But I am not doing that research, but there is a lot of research going on across the world, and particularly here in the United States, about trying to sort out medicines for opioid use disorder. I'm really glad you asked this question. There's some pretty promising research regarding medicines that one can take once every 30 days, for example. Right.
Are mushrooms out in Oregon? You're using mushrooms?
That
Which is
is not what I
psychedelic,
was
but
referring to. I was not referring to psychedelic research, but there is some research going on in psychedelics as well. But insofar as opioid use disorder is concerned, the horizon looks really bright in terms of other medicines that are developing for people that would really reduce the treatment burden, right? So that you don't have to come in as frequently, and you're more well if you take something on a regular basis that lasts over time instead of having to take a medicine.
half-life,
Yeah.
And then, may I just ask one quick question?
Of course.
What was I going to say? I can't remember what it was, but I don't remember what it was. Can I just have one of your cards, just so when I remember, I'll ask you?
Yeah.
All right. Thanks so
Please
much.
email me. Thank you.
Okay. Super. Thank you.
Good evening. My name is Jennifer Baldwin. I have been a citizen of this town for over 20 years, but more importantly, I've been a public defender for over 23 years, both in New Haven and in New London. The reason I mention that is I'm also involved with the overdose action team that was created out of New London in response to numerous overdose deaths that happened prior to COVID. I will just, one statistic before I ask my question, I have 0 cases of people that are selling their methadone in 23 years. My first question relates to the current sober houses and the Suboxone Clinic that exists currently in Madison. So there's a number of sober houses here in Guilford and Madison, and the Suboxone Clinic in Madison. Is there any plan to coordinate with any of those facilities to help get people some treatment?
Yeah, I mean, we do coordinate on behalf of all our patients with whatever resources that they're using now. So we saw case management on that list. People are not their diagnosis, as you're pointing out, right? And a lot of our patients have other medical needs. They have potentially other social or housing needs of one kind or another. And our staff, about 60% of our staff time is really used in coordination of one kind or another, trying to help people find housing, for example, or calling their physician because they have high blood pressure or what have you. So there's a lot of care coordination going on, so yes.
Awesome. If you do end up having a successful facility here in Guilford, there are a number of preventative programs that are run by the town of Guilford, specifically through Guilford Youth and Family Services, Guilford Day, the Guilford school systems. Will you work with those systems as well to address some of these preventative requests and to try to reach the kids before they can,
Absolutely,
to try to educate
yes,
them?
and we do quite a bit of that. Some of our team members here, again, Both Kelly and Kathy who are sitting here have been on the green down in New Haven doing overdose prevention, working with some of our social service agencies there in the community to teach CPR, for example, overdose prevention, other kinds of prevention services. We are very committed to that, absolutely.
And I just have one last question.
Sure, of course.
Out of the numbers of people that I think it was 55 people in Guilford and additional members in adjoining towns, how many of those current clients of yours that are in this community have asked you to move out to the shoreline to get easier access to their treatment?
Many people. It's a constant issue. And I'll tell you, transportation is a real challenge for some people, right? If you don't have a car, which many people don't, particularly on the front end of entering treatment for chronic illness like a substance use disorder, they're using public transportation, and it gets pretty complicated to come into some parts of New Haven. You have to come into town, you have to hang out in a certain place, you have to switch buses to get out of town. So this is really one of the key factors here, is to help people reduce the sort of daily burden that getting life-saving care has on their routines. When they can do that, then they spend their time doing other more positive things.
And if I'm correct, this is actually right on the bus line that goes up and down Route 1 throughout the shoreline?
It's right off the highway.
Thank you.
Yeah, thank you.
I appreciate it. Thank you for your work. And thank you, Board of Selectmen.
Hi, my name is Ginger Brasher Cunningham, and my question is about Guilford. Are you aware, and will you be aware, and will you teach the people who work in the clinic that we are a people who sometimes are passionate and fearful, so we yell out? Will you be aware, and will you teach the people who work here that we have, as a clergy person, I've officiated 5 funerals in 8 years for people who've had drug addictions and they've been in their 30s. Will you, her day mentioned, be aware and inform your clinic of our programs, such as DAY, which is pre for our kids, such as the school police in which they work with? Will you be aware, and will you commit to working with their 12-step groups at my church, at the ones on the green? Will you be aware, and will you commit to making sure everything is cleaned up around this facility? Will you be aware, and will you be committed to speaking kindly to all the people of town, even if sometimes out of passion they are not speaking kindly to you? Those are my questions.
Thank you for the question. I think I've maintained my calm this evening, and I feel very kindly towards people in general. I will introduce you to some of my staff here. This is our Director of Human Resources, Tina Burgett, who's a resident of New Haven. Dr. Catherine Eggert, who runs our program on Congress Avenue. Dr. Eggert currently lives in Old Lyme.
Correct. Born and raised in Brantford.
I was going to say, is a Brantford, born and raised in Brantford, and is likely to be part of the startup here in Guilford. We have Kelly McElreath, who's our nursing supervisor, is a resident of West Haven, and Michelle Machad, who's our chief finance person, who's a resident of Wallingford. So we live everywhere, my staff, and we care about these communities. We care about people. I personally care very deeply about people who have drug use disorders. And in fact, it's really my vocation, right, in many ways. And so yes, the answer is yes. We are committed to trying to integrate into the community and working with the resources that you have already on the ground here in Guilford. Absolutely, yes.
Thank you.
What do I do now, Ma? Hi, my name is Pat Pascal. I lived in Guilford for 43 years, and God willing, I'll live another 43 years somewhere. In any event, it's a little past my bedtime, so if I fall asleep, bear with me. You know, I am reading a book. Oh my God, yeah, several books. One of the things that I take away from this meeting tonight which I don't think is necessary, by the way, is just a large sense of cognitive distortion. I don't think half of the people in this room have really thought of it.
You gotta get to a question. Gotta get a
Say
question.
again?
I need a question of the app.
My question is, what did they use penicillin for? Can you help me with that? And what's the difference between penicillin and methadone? You've got an epidemic of opioid misuse in this country. We sit back, not in my backyard. This building was absolutely consistent with the zoning regulations, so why are we here?
That's the question. Let her answer that question.
My question is, what in the heck is the difference between penicillin and methadone? They're both drugs to treat something.
There is a difference, but the question I'm going to answer is the other one that I heard you say that, you know, because this building and its intended use is consistent with the zoning laws, you know, why are we here? We're really here to answer questions and to keep a dialogue open in the community. I am committed to continuing this kind of dialogue, and my team members in every other community that we are in do so as well. And I appreciate the sentiment. Thank you.
Well, I tell you, I'll get right off.
Next question. Gotta be a question.
Okay. My next question is, what in the heck are we doing here tonight? I'm going.
Hi, Courtney Tebow here. I'm a resident of Guilford. I'm also a mother of two at the daycare down the street, 460 feet within the said Methadone Clinic. So my concern is probably evident to you, but and a lot of people in this room, but my biggest question is, when they are administered methadone, what do they do next? So they're not allowed to spend any time at the clinic. Where do they go next? You had mentioned they don't have a lot of transportation. I know that's difficult for them. And this comment isn't saying I'm very in support of what you're doing, but I'm also extremely concerned for my two babies who are at the daycare down the street. And I'm also expressing the same sentiments for a lot of my friends and their concern over their children too. So.
Thanks, Courtney. Thank you, Courtney. I can say that in the building that we have at One Long Wharf, where we had a methadone treatment program that at one time had about 700 people in it. There was a daycare in the actual building. We literally never had a single incident. In North Haven, when we moved into that property, the ACES school was right there in the parking lot, basically. We never had any incidences with the school whatsoever. I appreciate your concern. And to your other question that I heard, most people spend around 15 minutes there, unless they're receiving other services. So you might come in and receive medication and have a therapy session, so you'd be there longer, right? So it's not that people aren't allowed to be there. We don't boot them out the door the second they receive medication.
But where are they going when they're waiting for the bus?
We'll make sure, and our patients will make sure, by and large, that there is not a lot of waiting around. So that's a really good question. One of the things that happens is we don't require people to come at a certain time. So they can come during the hours of operation. So what we find is that people organize themselves around their transportation. They don't want to hang out. Right, because they have other things that they're going to do.
I understand that, but I'm just kind of going through the process. If I'm a patient receiving treatment, I catch the bus, I get off, I'm at the clinic, I receive my treatment, say 15 minutes.
There's a big window there, and we know the bus schedule, and so we will not be allowing people to hang out in the parking lot.
But post-treatment.
Post-treatment. Right.
So that's my... So yeah, they can't hang out in the parking lot, so where do they go as they wait for their next bus?
They'll hang out with us until it's time for the bus.
How?
And again, what we learned in West Haven and North Haven, which also both have bus routes that stop in front of them, most people figured out a way to navigate there by car, right? So we don't have
So
a
then
lot
my
of
other
bus
concern
riders.
is, so
The
post-treatment
bus
of
riders are
the.
mostly coming into New Haven.
Yeah, so that's a great point too. So they have the bus route, but what about those that do have the car transportation?
Mhm.
How do you ensure that they're receiving the right amount of methadone so that when they jump back in the car, they're not hurting anyone in that big intersection, especially as we go and pick up our babies?
So again, working off experience, two ways I'll answer that question. Working off experience, we don't have experience of that occurring, right? We have literally
When there was just
thousands of
someone in
patients.
Trumbull who killed someone fatally and they were on methadone.
So that they may or may not have been affected by their medicine, I don't know that. I can tell you that people are on a schedule for receiving medicine, like how much they receive each given day, and they're under the observation of our nursing team members. We do occasionally hold on to a person because they appear to not be doing very well, but the schedule for induction or ramping up the medicine to a good therapeutic dose is very carefully thought through on behalf of our patients, and we have a lot of eyes on people to make sure that they're not impaired.
And then you had mentioned the half-life is longer so that they have this, effect from the methadone longer than typical. So that's kind of the benefit of it. But my concern is also you have eyes on them and they seem fine, but this half-life is bringing them through a longer period of time, and then they get back in their car and then do that.
I can tell you that there are a lot of studies, there's a lot of data out there that does not suggest that taking methadone as properly prescribed it prevents people from safely driving.
And then my last question is, when they are going to receive said treatment, what measures are taken to ensure that they have not taken any other medications that might interfere with the methadone?
And that's really almost 100% nursing observation, and our nurses get really good at this, right? They see patients literally every time. They talk to them, they look them in the eye, they have very good, well-trained judgment about how the person is actually doing. And as I said, there are times when we ask people to hang out with us for a while and sit around and wait, or ask them to come back tomorrow because today's not going to be, we're not going to be able to give them their medication that
So then
day.
they get back in the car and drive when they're...
Not necessarily. We have also at times really asked people not to drive, or ask them to give their keys, for example, to one of our team members. I mean, we really have, we make a lot of effort to keep eyes on making sure that people are not impaired. And we have very expert professional people in front of our patients every day.
Okay, thank you.
Yeah, thank you, Courtney. Thank you.
My name is Colleen Otis. I live on Raymond Road in Guilford. Miss Madden, I have a couple of questions.
I think they can hear you, Colleen. They can't hear you very well.
I have a couple of questions. The first one is I recall when you presented at the Planning and Zoning meeting, these were the numbers that you quoted for residents from Guilford, Brantford, North Brantford. But you said you talked about patients coming from New London. And I thought you said there were 400 of them.
No.
How many do you expect?
The total number of people who are using our services now from Brantford to North London, so those are several towns, many towns up and down the shoreline, is 389. That's the total number.
So it would only be, so there aren't that many coming from New London.
250, 76 or something, someone did the math for us earlier, are right here, as I showed those data. Yeah, others are currently driving from either mostly north of there into New Haven when they have to.
Okay, so then I misunderstood you.
Yeah, thank you.
I saw the real estate transaction in the paper in mid-August, and I spoke with Matt then. So I've been doing a lot of research. I'm a retired nurse. I have dispensed methadone. So I have experienced the culture of a methadone clinic.
They really can't.
When you moved from Long Wharf, some of the recommendations that were meant or that you included in the clinic
in Long Wharf was to have an indoor waiting room, which you didn't have at the other facilities. And the other thing was that they could remain on the property when they couldn't before after their dose.
Okay, so I'm not sure I entirely understand the question, but we still are operating on Long Wharf, so we haven't moved from Long Wharf.
All right, but do you have an indoor waiting room there?
We do, absolutely we do.
But you don't at your other facilities?
We do at all of our facilities
Now you don't.
Part of the challenge that we had at Congress Avenue back along is that we didn't have a very big waiting space for people. And we have spent some time and money really expanding that waiting space so that nobody waits outside. That's absolutely not a goal. I don't think that it's appropriate or respectful for people to have to wait outside.
Okay. Now, we have a two-town transit grant, and I think that will be starting at some point. How will people travel east? How can they connect toward New London with public traffic? They can get to Madison, but how would they get farther? Because you did speak about New London.
Yeah, what we have today is we have people who live in New London who travel from New London to New Haven.
Wow.
Yes, so those are the people that we're talking about. They've got that sorted out somehow. So we do have a group of people who do that.
Okay. And the other question is I have heard that in addition to dispensing methadone and doing therapy, that you plan in the future to have a residential place on your property in Guilford.
That's absolutely not
Or
true.
like a halfway house.
No, so the question, if people can't hear, is that there somehow is a plan for residential or halfway house treatment program on our property in Guilford. That is 100% not true. That is absolutely not entered our planning whatsoever. We have a residential treatment facility. It is in New Haven on East Ramsdale Street, and we have no plans to create more residential treatment.
Okay. In my research, and people can Google this, I spoke with somebody. I know a few people who have dispensed methadone, nurses, in New England and in Syracuse. And I also checked out Galveston, San Diego, and Vermont, Massachusetts. The common plan when a methadone clinic is located in a town or a city, the strong contiguous recommendation across the board is that not in a residential community. Mayor Elliker said that after the New Hallville kerfluffle was settled. Not in a residential community, not in a commercial area, but in an industrial area where it's a little more isolated. So it's not just that the people in Guilford are delusional.
I have not said that the people in Guilford are delusional.
No, you didn't, but there's kind of a negative reaction to it in general.
And I didn't imply that the people in Guilford were delusional. In terms of the zoning laws and rules, I would just state again, this is considered outpatient medical treatment, and it fits into the zoning plan of the community of Guilford. Again, respectfully, that's what we were looking for, is property that actually matched the town's zoning laws. And we did look all up and down the shoreline for property. Easy access off the highway was really important. This is the space that we found after several years of looking. And it's centrally located for the region that I described, and will be, and our patients will be able to navigate there very readily.
Because we do have 3 highway exits, and in fact, right near exit 58, there are 2 buildings that are available. So, this is our home.
you know, we live here. Everybody who works at the clinics will go home. So we are concerned. We have genuine concern. Thank you.
My questions won't be so difficult. My name's Tony Paterzo. I'm from Guilford. You have 70, 80 people that are going to be coming in and out here in a day. You have 70 or 80 people that are going to be coming in and out of this clinic every day.
Yep.
How many parking spaces are you going to have in your parking lot?
I should know the answer to that question off the top of my head, but I believe the answer is 27.
27 for
Yeah.
70 people coming in and out. Okay.
Right, over
And
8 hours.
How many are handicapped?
However many the town requires, right? We follow the rules absolutely to the letter.
Okay. Has there been a traffic study done yet from the Department of Transportation?
There was not a required traffic study for this location. We did have to ask permission from the Department of Transportation to fix the sidewalk ramps that are right there. We're, at the request of the community of Guilford, we're making a contiguous sidewalk there, and the way the sidewalk ramps are, you have to get today, they're not as good as they could be, you have to get a special permit from DOT,
Okay.
and we're doing that.
Just a quick question to Matt. When the hospital put on additional rooms in the hospital, they had to do a traffic study. Why wouldn't this have to be done here?
I think that's the Office of Healthcare, the state of Connecticut
Okay,
requires.
so that's another question I have. Has your drawings for your building and everything been filed, or do you have to file them with the DPH?
Okay, that's a really good question. So you're talking about the Department of Public Health.
Yes, I am.
So the Department of Public Health, or DPH, will ultimately license the facility. When we create the drawings, we have conference with DEA, the Drug Enforcement Agency. That has been done because they have to approve the storage of the medication and that sort of thing. And the plans have been run by DPH.
All right.
We will not receive a license, of course, until the facility is completed.
Okay, so
To their
then
satisfaction.
when they have those drawings, we're sure that nothing else is going to be built on the property where that garage is?
We have no plans to build on the
Okay.
property where the garage is.
All right, that's all I need.
Yeah,
All right.
thank you so much.
That was easy. Thank you. Oh, you can clap. Go ahead.
Do I have to give my full name?
Yes, please.
Oh, okay. Hey, Jill Paglino, and lived here for 21 long years. My question is about like the profile of your typical person who uses methadone, because I don't really know anyone who uses methadone. I feel like people here are kind of assuming that they're like dirty, bad people who've made bad decisions and thrown their lives away, and that's what's led them to methadone. Some people feel that way. But my impression, just from what I've heard, is that like they hurt their back at work, they got prescribed OxyContin because they were told it wasn't addictive, but then it was addictive. And then their doctor said like, well, I can't prescribe this to you anymore because you've run your course. And then they had to either, I guess, go find heroin or go find methadone. Is that the typical trajectory, or am I missing something?
You are not missing something. It's a really interesting question that you're asking. So I'll try to answer that really very specifically. So in terms of asking about profiles of persons who use methadone treatment, I can give you the demographic information from the APT Foundation, right? So we have approximately 3,500 people across our locations who are methadone, patients who use methadone, or people who use methadone. They are predominantly Caucasian. They are in their late 30s to mid 40s. There are more men than women, right? So that's the profile. About 45% of them come through the door. Now, their first day with us, they're already employed, right? So it is not true that everyone who comes into treatment programs doesn't have a job and all of that kind of thing. About nearly half of them are employed on day one. That number goes up over time. We have vocational services that are embedded into all of our programs because finding ways to support yourself and having meaningful activity to do during the day or the evening or whenever you work is part of, quality of life that people have.
And is it typically people who got prescribed OxyContin because of an injury?
That is now true. That isn't where we started in this country with the opioid use disorder issue, but there was quite a long time period of prescribing pain medications, opioid pain medications to people so that they had zero pain, right? So though some of you may remember that, there was a lot of opioid prescribing. That is actually starting to decline. So in 2017, the federal government released opioid prescribing guidelines for primary care providers and internists and other folks on the front lines of medicine that really make recommendations about shorter prescriptions and maybe lower doses, all of that kind of thing. And we are seeing that the rate of addiction, at least as prompted, if you will, by legally prescribed opioids, is in fact declining. Yes.
Okay, thank you.
Mm-hmm. You're welcome.
Hello, my name is Lee Nathan. I'm a resident of Madison. Is it okay for me to ask a question?
Sure.
Okay, thank you.
It's not a closed meeting.
Thank you. I'm also a physician. I practice in medical hospitals, and I want to thank you for the work that you do. I practice in a different part of the state, but in that part of the state, we treat people with opioid use disorder who need methadone maintenance or Suboxone, buprenorphine, and who have a really hard time having the maintenance treatment for that in their communities. So I think it's really important that we carefully consider accessibility to this care for people who have a medical emergency in a medical hospital and need continuity of care. There is maybe not an inpatient hospital, but the Yale New Haven emergency room is just on the other side of the highway from the proposed site. Right. And there have been concerns about safety of people who operate motor vehicles in the context of this health care service that's being administered in the Methadone Clinic. Do you foresee any difference or any increased risk or change in risk for people who receive methadone maintenance in the clinic as compared to the urgent care center that is just on the other side of the highway where controlled substances and medical conditions are treated?
Yeah, thank you, Lee, for that question. I don't. I mean, we, as I said several times, pay careful attention to, best clinical practice. Our induction guidelines, in other words, how do you get somebody on a medication and then get them to a proper dose, are very carefully followed. And we have a great nursing staff who look at patients every day. They have instant access to both physicians and advanced practice registered nurses. We could call any of them now. Right, so there's a lot of eyes on, clinical eyes on the persons who are receiving treatment. Thanks.
My name is Al Brown. I've been a resident here for 23 years. And I was a little bit disturbed about this clinic that you're bringing in.
You gotta pull the mic down a tiny bit. Down a little.
I'm a little short.
It's okay.
All right, so the thing is, we were not informed about this earlier. And Mr. Hoey and I were friends before, but I think he said that, well, if people came to me and they were going to buy a piece of property, they were going to buy this building, and to keep it quiet for them. Well, I understand that. That makes sense. But this is not the ordinary thing. This is not the ordinary thing. This should have been brought out to the town long before this lady is sitting here. We should have had a chance to digest this at least, and we didn't get that.
No, we didn't. It was a month ago I found out. 1 month ago. And it was
Okay. Is there a question? Yeah, what's your question now?
Maybe she saw it a month ago, but I didn't see it anywhere. 5:30 in the morning is when they come, and 1 o'clock in the afternoon they leave. Well, 5:30 in the morning, a little early for me. The only thing I know about 5:30 in the morning is burglars and bad women. So I understand they're coming in at 5:30 in the morning, but they won't. The kids are going to be getting ready to go to school. They're going to be out at the sidewalk. They're going to be waiting for the buses.
We need a question. You have a question?
What?
We need a question from you. This is a question and answer session.
All right, so what I'm saying is the kids are going to be coming out to get on the bus. And there's going to be people there either coming or going. So there's only going to be 80 people. Are drugs slowing down? That means it's going to be more coming. There's going to be more problems. We never saw a needle or anything on the side of the street. No, none of our places. I find that hard to believe.
Al, the question, please.
What?
The question, please. You need to ask a question.
Oh, I don't have a question. I just want to repeat that. All right.
Thank you for your comment.
So all I want to say is, I don't think it's a good thing for Guilford, and that's it.
And Alan, I'd be disappointed if we weren't friends when this was over because of this. But one thing I want to make clear, as soon as the transaction happened, I reached out to the newspapers to put the story out into the community. The Guilford Courier, the Connecticut Examiner, and the Hearst newspapers, and they all had stories within a couple of weeks. It has been in the public domain since August. So, thank you. Next up.
Hello, my name is Jason Markey. Just for full disclosure, I am a planning and zoning commissioner in town, but I'm an alternate. But I just wanted to make you aware of that. I also used to write for the short publishing newspapers for 17 years. I just have two questions for you. I know you said that you don't intend to put housing there, halfway housing, but would you make a statement guaranteeing that you would never really want to do that in that spot and keep it more as a small clinic?
We have absolutely no intention of putting housing on that property. And I can tell you, just by way of trying to support that statement, our residential treatment program in New Haven has shifted over the last 18 months from 172 beds to 142 beds. So that's actually declining as part of our service mix.
Okay, and one more question, Doctor. I'm a little unclear on how much room you have for the people who might be waiting to leave or coming in as you have your traffic flow. So if some of those people do leave the building, would you be willing to build some sort of bus stop shelter for them?
Yeah, that's a really good question too. We did build a bus shelter in North Haven. We built a bus stop shelter there in North Haven. And also the floor plan has gone to the building department so that we can get a permit. I'm sure you can get a look at it. But there is an adequate waiting area there.
Okay.
Yeah.
So Jason, in answer to your question about housing,
Yeah.
in answer to your question about housing, that zone PR, let's get this wrong, Post Road Business 3, PRB3, I'm sure you have this thing practically memorized.
Well,
right?
almost.
But in order to have assisted living, congregate living, nursing homes, you would have to have a special permit, which would in fact trigger all the steps, or at least most of the steps that people have concerns. So
Okay.
the use that is being underway right now did not require that. That step would in fact require that.
That's what I was concerned about too, because I did read that in the statutes that a special permit would be required if you were going to do any kind of housing, and that would require then the public meetings, one or two of them. Someone did tell me that ADA law by federal might usurp and completely override the local planning and zoning rule in that regard. But that wouldn't be true. Okay.
Not to my knowledge.
Great. Thank you.
Different set of problems.
Okay.
Hello, my name is Sarah Edmond. I'm a Guilford resident and a licensed clinical psychologist, and most of my job is working with patients with chronic pain, some of whom also have opioid use disorder, and I have provided care to patients who live in Guilford, who use APT, who wish that they could get that service here. My question is, given the concerns expressed here and the general sense that people felt like this came out of the blue despite that it was in the papers in August, I'm wondering, could you tell us, when do you anticipate opening here? And between now and then, what is the best way for the community to continue a dialogue with APT?
Yeah, thank you, Sarah, for that question, and thank you for your work on an ongoing basis. The construction timeline looks like it will start sometime around the middle of this month of March. So I guess we're in February. March is in a couple days. In the middle of March, and it's about a 3.5 to 4 month build out. So we're looking sometime in. We're anticipating around August at this point. Yeah, thanks, sir.
Matt, can I ask one more question? Certainly, Jason.
Okay, my final question is, with the additional 2 acres, 2 lots, 415 and 417, I think you made a statement that you're using one for the garage and back for vehicles and so forth, maybe supplies and all that. Do you have any other intention for those 2 lots? Like maybe expanding parking or something?
Yeah, that is a really good question too. We think we have, by zoning laws, we have adequate parking there. That would be about the only thing that we might do, would be to extend parking. But that piece of property has other considerations at this point, where there's some other wetland considerations there and that kind of thing. So we really haven't made plans for that. The garage itself, we've actually put some resources into that garage to fix it up. The heat wasn't working, another number of other things like that, and we are using it as a garage at this point. Yeah.
Anybody else?
My name is Kristen Hunt. I've been in Guilford town for 21 years, but I also have family who's been here forever. My biggest concern is you're going to have people coming from the city, coming into town, getting what they need, and then possibly lingering around, not only in front of the building, but around the Dairy Queen, the gas station where all the kids do, the Green, and you also got a hotel, which my grandparents used to own many years ago, up the street. And I have family right across the street from that, and you have not considered any of that?
You have a question? That's phrased as a question. I think Lynn can respond to that.
Yeah, I can respond by saying that what we considered were the zoning laws and rules of the community. This is not a program that's intended for people to come out of the city, as you say, into Guilford to receive services. There are services more conveniently located for those individuals. There's no.
So you're telling me that people that are coming to this clinic of yours are only going to be strictly from Guilford?
No, when we showed some of the data earlier, the people that we are planning to have use this program live from Brantford north, if you will, to New London, and all total, that's about 400 people. Right?
Well,
so they're not people who live in New Haven currently, and some of the Brantford people, frankly, will continue to use services in New Haven because it's closer for them. Right, so I gave you the full census of the number of people from Brantford, but that's not the, some of them.
I'm just concerned because a lot of the kids are telling me it's open 6 days a week, and on Saturdays the kids are all off from school, and they all hang out in that area. You're telling me that this isn't going to have any issues with them?
Yeah, I appreciate your
judgment.
Concerns. What I'm telling you is that we follow the applicable zoning rules and laws that allow this medical clinic to be there, and that was the essential consideration, along with ease of transportation for people to use the service.
Oh, and again, the taxes are going to go up for us too, I'm sure.
I would like to speak to that, just if I could. The reality is that we have not had specifically frequent needs to use fire services or police services at our other
Wait until
locations.
that comes in here, then you will.
Mm-hmm. Thank you.
Anybody else?
Can I just follow up with one more question?
Yeah, run up. I'm not actually the mic, because this is going to be on. Bring in the mic. Yeah.
I'd rather stay here. Thank you. I just want to bring up a question about
the timing of the purchases, it sounds like there were multiple lots purchased. So it sounds like from what you're telling me or us, some of the lots that you purchased are unusable, right? They're wetlands and you can't really do much with them. So what I'm hearing is that the Play Cafe was under contract by another buyer, and that then these unusable wetlands were purchased by APT, and then I guess maybe that original purchaser didn't want to be adjacent to this location, or I don't know what, and then APT purchased the Play Cafe. And I'm just wondering if that particular location, while it is close to the highway and it's convenient, again, I still also want to draw on the conspicuous nature. If, you know, another gentleman indicated that, you know, somebody within Guilford is, you know, shy about his situation, you know, it's a really conspicuous location for people to come. Is he going to have the courage to go there? But the question is, you know, was it because our town allegedly or seems to have weaker zoning regulations that our town was selected?
No, so thank you for the question. So I have looked at property really literally all up and down the shoreline and in many parts of the sort of towns and cities around New Haven. Guilford does not have weaker zoning laws. We were looking for properties that we could legally locate to in respect of the zoning laws of any particular community. So you don't have weaker zoning laws.